Good morning, everyone, and welcome to the United Nations Children's Fund, or commonly referred to as UNICEF. My name is Ann Veneman, and I am the Executive Director of UNICEF. And we want to especially welcome all of those who are joining us today by live webcast. The Web4Dev conference is an annual event in the United Nations. For the first time, UNICEF is hosting this conference, which will explore ways to better use technology to address global development challenges. The participants in this conference include representatives from academia, the private sector, and the field of development, as well as many others. The task here this week is to put innovation and technology at the service of humanity. And there are some exciting innovations that will be introduced at this conference. In 1963, when addressing the General Assembly of the United Nations, President Kennedy said, quote, "The effort to improve the conditions of man is not a task for the few. It is a task for all nations, acting alone, acting in groups, acting in the United Nations. For plague and pestilence, plunder and pollution, the hazards of nature and the hunger of children are the foes of every nation. The earth, the sea, and the air are the concern of every nation. And science, technology, and education can be the ally of every nation." End quote. These words ring as true today as they did 46 years ago. The world is more interconnected than ever before. In 1492, it took Christopher Columbus 70 days to reach the New World, of a voyage of about 4,000 miles. Today, a message can travel that same distance at almost the speed of light, or about 280 million times faster than the Santa Maria. In effect, this means that the Earth of Columbus's time has been shrunken to the relative size that is just slightly larger than a golf ball. This conference will focus on improving access to life-saving educational information, the process, speed, and accuracy of data collection necessary to make important decisions, and the delivery of supply chain items in remote locations and in emergency situations. These are areas that cross-cut the work of United Nations agencies and their partners and will help in reaching the Millennium Development Goals. The mobile phone and the computer are tools that are used by well-established networks to conduct business and share information. The mobile phone and the internet are used for instant cash transfers, providing health updates, distance learning, if not to swap opinions of who is the best hip-hop artist in South Africa or the top football player in the Premier League. Often, the best innovations are new ways to work with existing tools, from a high-speed internet connection and a computer to a smartphone or a simple mobile phone. The mobile phone is increasingly becoming a smart computer and the communications tool of choice in the developing world. At the end of 2007, there were some 3.3 billion phones in use around the world. An estimated 64% of mobile phones are now in the developing world, and there are some 1.2 million new connections every day. Today, there are 280 million mobile phones in Africa, which is more than in the United States and Canada combined, with 277 million phones. Mobile phones are being used to collect and disseminate data, including important health information from remote villages in Africa. An estimated 9.2 million children under the age of 5 die each year, mostly from preventable causes. Malnutrition contributes to about a third of all under age 5 child deaths in developing countries. Immediate access to data can provide real-time information on drought, diseases, and malnutrition, allowing needed food and medicines to be more quickly and effectively deployed. Through mobile phones, community-based health workers and families themselves can provide important information about the health and food situation in remote villages, which can then help shape the responses. In drought-stricken areas, where people may lack access to basic food, the outside world can be quickly alerted to provide a more timely response. At a community health center, children might be showing signs of malnutrition. In the past, it might often take several days, even weeks, to collect and transmit data and information to those who can provide needed supplies. In Malawi, health workers are using text messages to send information instantaneously on malnutrition from remote communities. This helps ensure that life-saving supplies can arrive in time and in the quantity needed to help avert suffering and prevent deaths. In Ethiopia, when faced with the possibility of famine following drought in the south of the country, UNICEF last year pioneered the use of data collection through mobile phones and rapid SMS technology. The information collected helped monitor supply of needed treatments of acute malnutrition. The data helps ensure that the distribution centers have the required treatment ready to respond to cases of malnutrition. The AIDS pandemic has taken the lives of millions of people around the world, with hundreds of thousands of new infections every year. Every minute you listen to me speak, around 5 more people have contracted HIV. Because of AIDS, life expectancy has plummeted from the mid-60s to around 40 in several countries in southern Africa. In those countries, turning age 20 means reaching middle age. To break this cycle, young people must understand how the disease is transmitted and how to reduce the risk of contracting HIV and AIDS. Here, too, mobile phones have played an important role. In Uganda, hundreds of participants in an HIV/AIDS SMS quiz program, Text to Change, have voluntarily visited a health center for testing or counseling after learning more about HIV/AIDS through quizzes that were sent to their mobile phones. Efforts such as these can help prevent the spread of HIV and AIDS while also ensuring that those who already have contracted HIV can get life-prolonging drugs.